So what do you think about melatonin supplements and things like that that are helping us to fall asleep? Is this kind of what you're talking about in the beginning, where maybe we're putting a Band-Aid on
Sure.
something? What what happens to someone who is taking a melatonin supplement or something similar like that every night?
I have no problem at all with melatonin and sleep aids. I mean, you're better off to do that than go without sleep.
Okay.
But then again, one needs to look under the hood, so to speak, and find out, why am I not sleeping? Is it too much stress? Am I eating the wrong things? Is it too late at night? Uh, am I spending too much time on my iPhone or whatever? So that's all important to do that. But melatonin is probably one of the safer modalities, and melatonin has actually been shown to have good immune stimulating properties. L-theanine sometimes can help relax the mind. Also, it can be an indication of a lack of GABA, and I'll have patients tell me, well, I wake up and it's like the pause button's been on and I hit the play button, and then my mind continues to pick up where I
Right,
left off.
right. When you wake up and
Yeah.
you just can't fall back to
So
sleep.
that could be a problem with the GABAergic receptors, and GABA is a calming substance that helps with that. And I prefer to take a liposomal form of GABA, because if you take an oral form, it has to get digested, and sometimes you don't get enough in the brain. And so taking a liposomal form of GABA and L-theanine and melatonin uh, is an excellent
What is
therapeutic.
what does that mean exactly? I'm not familiar with liposomal.
Oh,
Liposomal.
liposomal. Uh, it's a liposome is like a special fatty molecule. It's like a molecular carrier. A lot of drug companies are now using liposomes, or a fat. They take the substance. It's a great delivery system. They take the substance and then immerse it in a fat soluble molecule, and you've got 70 to 100 trillion cells, and each cell has a membrane. Well, that membrane consists of 50% fat and 50% protein. If you take a liposomal form, it's like under your tongue, gets absorbed directly into the bloodstream, and it can go directly into the cell.
Interesting.
And it doesn't
Okay.
have to be digested, go through the liver, et cetera, et cetera. So a lot of the drug companies are using liposomal delivery system for their drugs and medication, but especially GABA works much better in a liposomal form in order to enhance the delivery.